project on tuberculosis. Tuberculosis is a bacterial disease that spreads in the air as someone who is infected by the bacteria coughs, sneezes, or breathes, and the bacteria infects someone else. The bacteria typically attack the lungs, leading to lung damage and possibly death if not treated properly. Initial signs of tuberculosis include weight loss, coughing, body weakness, fever, night sweats, and chest pain. Because TB attacks the lungs, feeling chest pain or finding it hard to breathe is also a sign that you may have tuberculosis. In more severe cases, coughing up blood is a symptom that you might want to get checked out urgently.
Treatment with a combination of 4 inexpensive drugs can cure 90% of individuals with active tuberculosis. They must be taken daily for 6 to 8 months, regardless if symptoms go down, in order for the pills to work. If you stop using them, then tuberculosis could come back and spread to others. However, recently, incurable deadly forms of tuberculosis, known as multi-drug resistant tuberculosis, have been on the rise. It can't be treated with antibiotics, so victims are told to permanently quarantine from society. Cases are rising because of the low screening programs, genetic resistance to those effective biotics, and higher chances of coming into contact with someone with the disease. It's a big problem, which is why the government is putting more money into this cause annually.
Lifestyle of tuberculosis and the vectors for transmission. Tuberculosis bacteria spreads through the air from one person to another, and it's usually carried by air particles called droplet nuclei. When a person with tuberculosis disease of the lungs or throat coughs, speaks, or sings, tuberculosis bacteria can get into the air. People nearby may breathe in this bacteria and become infected. More specifically, when TB bacilli are inhaled, they rapidly pass through the mouth and nose and pass into the lowest and smallest parts of the airways. TB infection happens in 4 stages: the initial macrophage response, the growth stage, the immune control stage, and the lung cavitation stage. These 4 stages usually happen over roughly 1 month. How tuberculosis has affected the world. Every year, 10 million people fall ill with tuberculosis. Despite being a preventable and curable disease, 1.5 million people die from TB each year. TB is a leading cause of death of people with HIV and also a major contributor to the antimicrobial resistance. The Southeast Asian region has the largest amount of TB cases. 46% occur in this region.